Hello, and thank you for joining us for this training designed to support occupational therapists to feel more confident with providing their patients with fit notes. My name is Jenny Cooper, and I am an advanced occupational therapist working within a primary care network. I work across a number of GP practices, providing vocational rehabilitation services, and part of my role also includes providing fit notes to my patients. By the end of this training, we hope that you will be able to recognise the occupational therapy role within fit note completion and health and work conversations. We hope that you will be able to understand the purpose, context and legal framework of the Allied Health Professionals Health and Work Report and the fit note. We hope that you'll have a bit more confidence to communicate work-related functional information clearly and effectively, and also be able to apply your core occupational therapy skills to support fit note decisions with confidence. So what do we mean by work? Work can include any of the following: paid employment, self-employed work, work experience, vocational training and apprenticeships, education and training, volunteering and carer roles. However, when considering the provision of a fit note, our main focus would be on paid and self-employed work. And this is just due to the fact that the fit note can assist your eligibility for statutory sick pay, also known as SSP, which you wouldn't be eligible for if you were in an unpaid role or within an educational setting. So why is good work important? Well, research shows that work is good for you, but particularly if it is good work. In general, work is good for you as it provides a meaningful routine and it gives us purpose. It can also give us an identity and a role. One of the leading conversation starters within a social situation can be, what do you do for work? And therefore our job can be quite a defining factor of who we are as a person, providing us with a sense of belonging and social inclusion. And when it comes to good work, we focus on the enjoyment and the meaning in this, which in itself can lead to people having further career aspirations. If you enjoy what you're doing at work, you want to do well for your employer, you want to do well for yourself, it can lead to a sense of achievement, feeling really good in what you're doing, and that contributes to our overall health and well-being, keeping us healthy. And at its basic core, work provides us with financial stability and security. And when work is good work, it just provides that enjoyment, that challenge in life, and as I've already mentioned, contributing to your overall health and well-being. So bearing in mind all of the positives of being in good work, try to think of how this could affect someone if they were in a role that they didn't enjoy or a work atmosphere that was difficult. Imagine being unemployed or on long-term sick leave. If good work provides all of the positives that we've mentioned previously, how do you think it would affect you if work wasn't good? What if you require time off work and your pay reduced to statutory sick pay? What if you were unemployed and therefore you don't have an answer to give to that person who asks you what you do for a living? In my practice, I see it time and again, the downward spiral that someone could potentially take when they're off work. I see these comments, people feel guilty about the fact that they're off work, worried that they might get sacked because they aren't in work, don't know what to do with themselves, can't be bothered to do anything, concerned about what colleagues might be saying about them, not wanting to go in and visit work because of that, might not know what to say to the manager, and the manager, will they believe them why they're off sick? And as we've mentioned, if your pay reduces to statutory sick pay, it's not a lot. Maybe they can't afford the rent, the mortgage, how they're going to pay the bills. That can lead to people sort of maybe smoking and drinking more as a coping mechanism, feeling low in mood. I see this a lot where people say they feel they can't go out in case someone sees them, and then that leads to other thoughts, and a lowering in mood. They've got no reason to get up, washed and dressed. I've got nothing to say to anyone, I want to be by myself. Struggling with sleeping, might need sleeping pills, and all these sort of really negative thoughts that come with being out of work, I suppose. And like I say, I do see it a lot where people get out of the routine. As we've said in the previous slide, work provides you with a routine, it gives you a reason to get up. If you're not in work, what's the point? So yeah, I do see it where I get this downward spiral of people sort of getting really low in mood, not wanting to do anything, and really, really struggling because they're out of work. It becomes a real vicious downward sort of spiral and cycle, sort of leading to that lack of routine, lack of purpose, and losing a sense of who they are as a person. As previously mentioned, we know that being in the right work is good for health. Returning to work after unemployment improves health as much as being unemployed damages it. Therefore, intervention and support in this area is key. It's also been proven that being in work can aid recovery for people with physical or mental health conditions. So, bearing that in mind, as occupational therapists, it's really important that we are focusing on work as a health intervention to support our patients. What do we actually mean by the term vocational rehabilitation? Well, here it is defined as whatever helps someone with a health problem to enter, remain in, or return to work. As occupational therapists, we focus on assessing the impact of changes to health and well-being on any occupation that matters to the person, and therefore work is often an important occupation for the people that we see. And as occupational therapists, we absolutely have the core skills to deliver person-centred vocational rehabilitation within our clinical practice. How, you might be wondering? Well, maybe think about some of your core OT skills and how this could translate to completing an assessment with a person with work-related issues. It can be quite daunting, but let's break it down to its component parts. So, activity analysis. Just like you would assess someone's ability to complete a task in the kitchen, for example, can they problem solve? Can they sequence the task? Are they able to use the equipment safely and independently? This can translate exactly the same into a workplace assessment. So, thinking about it in work, what does the person need to do to complete their task at work? What materials and tools do they need? And do they know what that is, what that looks like? Can they use them safely? Just like you would observe someone using a knife, for example, to chop up their vegetables, making sure that they're safe, using those skills to risk assess the situation. You might want to observe how a factory worker is able to use their machinery within work, or how a shop worker is able to stack items onto a shelf. Do they have the strength? Do they have the balance? Are they safe in doing the task that they're doing? Can they use everything they need to appropriately? It's the same type of assessment that you would do with someone in a kitchen, just in a different environment. And I suppose just for reassurance, really, you would usually always do this with a manager present. So there would be someone there to support you in knowing that what the person is doing is right. We don't expect you to know everything about every single occupation in the world. That just isn't going to happen. So there would usually, as I say, always be someone there to support you with gaining a bit more of an understanding of what that role entails and if what you're watching the person do is correct. And then you can use your own assessment skills, clinical reasoning skills to decide what the support the person might need in work and just to inform that assessment. And as part of your assessment, you might recognise that the task needs adapting. And again, just like you might recommend an adapted chopping board to support someone, for example, with reduced grip strength, to prepare their food in the kitchen, looking at this in the workplace, if someone's got reduced grip or arthritis in the hands, for example, and they work in administration, you might want to look at an ergonomic mouse or an ergonomic keyboard to support them in that role. I once supported a park ranger who had a Dupuytren's contracture in his hand. And by the time he'd come to see me, he'd been off work for around 6 months. And he was really keen to get back, but one of the main things that was keeping him from going back was the fact that his hand could swell and could be quite painful. And due to health and safety, he had to wear gloves as part of his role, and he would need to be wearing those to do his tasks, for example, like litter picking or mowing the grass and things like that. But he had to take those gloves off to get in the vehicles to drive around the parks. And that was non-negotiable as part of his role. So as part of my assessment, I recommended um, that he have a larger pair of gloves. Really simple recommendation, um, to enable him to take them on and off more easily. And that was accepted by his employer, along with some other amendments to his role, and he successfully returned to work whilst waiting for hand surgery. So it's just an example there of some really small sort of bits of equipment changes to a task that can support someone to manage that more independently. So again, just as you would adapt the task in the kitchen, you may look at adapting the task and providing equipment in the workplace. And it might be that the task also needs adapting. So, for example, with the park ranger, as well as larger gloves, we also have some small adjustments made to his role. Due to reduced grip strength, he himself identified tasks that he could still complete, that he felt were more achievable, such as litter picking and bin emptying, because they were a bit lighter duties. But he sort of reported that maybe heavier two-handed tasks would be a bit difficult for him. So things such as hedge trimming or mowing. So that was a conversation with he himself, who identified the things that he thought would be difficult. We agreed with his manager that he would work with another colleague at all times, so he didn't have to worry about driving. So again, further rests for his hands in between tasks. And his tasks were amended to support him to return to work, and it was agreed that he would do the lighter duties, particularly whilst he was waiting for surgery on his hand. And I think I would say it's really important to get the person's views on what they think they can and can't do in their job role. What are their strengths? What are the weaknesses? What do they perceive that could be changed to help support them in work? And then you can use that as a basis for discussion with their employer to look at what adjustments they can reasonably make within the confines of the role, because ultimately the patient is the expert in what they do. All adjustments usually need to be considered within the boundaries of the business. Just because we recommend it doesn't mean that it should be changed if it's not practical for the business to be able to do so. But even just little small changes can make a difference. So just like here on the slide that you might advise someone to pace their daily tasks, this is really easily translated into the work area. So just like you might encourage someone to break up a cleaning task to do it throughout the day to conserve their energy, you can recommend that they take regular breaks between work tasks. Maybe they take on less duties to help accommodate that, working flexibly within their work hours and things like that. So it's just thinking a bit more creatively about the recommendations that you're making. And you may need to also consider making adaptations to the environment that the person's working in to enable them to access their workplace safely and independently. So again, just like you might assess someone's home to make recommendations for environmental changes and adaptations, the workplace may also need adapting to aid this as well. So for example, I had a lady with rheumatoid arthritis who was working as a social worker, and she became a permanent wheelchair user. And although her work office had a lift and it had disabled toilets in facilities, she was unable to open the doors independently as they were quite heavy. It was difficult for her to manoeuvre her wheelchair through as well as opening the doors at the same time. So obviously taking quite a bit of independence and dignity away from her, really. So I went out and visited the workplace with her. I sort of met with her employer and a health and safety officer at work to look at what was reasonably practicable to put in the workplace and just look at how she could access all areas that she needed to in her wheelchair. I recommended automatic door opening mechanisms so that whenever anyone walked up to that door, it would open automatically, and hopefully providing benefit to other staff as well. And we also looked at the kitchen, because that was one thing away from work. We were sort of having a chat about wondering whether she would be able to access everything she needed to in the kitchen. So we did look at whether she might need like a high-low worktop adaptation putting in place. However, we had a look at that with her and she was quite happy with the kitchen as it was. There was plenty of space. She was able to access everything she needed. She was still mobile and ambulant, so she could stand up and use areas in work if she wanted to. But equally as well, if there was a day where she was struggling to get out of a wheelchair, then she didn't need to and could access everything she needed to. So those recommendations were then taken away to look at with the funding parties for the building as to what they could provide for her. As with any adaptations, it is the case that the funding element does need to be looked at for the adaptations to be put in place. But again, using your transferable skills and knowledge, I'm sure you can easily see how adapting a workplace environment does involve the same skills that you would need to use in order to assess someone's home environment. So it's just building that confidence with the transferability of the skills that you've got. And last but by no means least, communication. Communication is absolutely key when looking at making recommendations for adaptations and adjustments to support someone to remain in or return to work. Just like you might speak with family members or carers to support with the implementation of your recommendations, speaking to the person's employer can be instrumental in supporting the person that you're working with. Speaking to their employer can help you to further understand the intricacies of the person's job role, along with discussing what amendments and adaptations the employer are reasonably able to support with that person in the workplace. I suppose all I would say is, just because you make a recommendation, unfortunately, it doesn't always mean that the employer has to implement this, particularly if it's not deemed reasonable for the business to do so. And, that can be really, really frustrating as an assessor. But again, translating into other areas of practice that you may have worked in the past, it's only like recommending a piece of equipment that gets declined through statutory services due to funding constraints. It's just making those recommendations and having them declined in a different clinical area. So sometimes we have to be a bit creative in the recommendations that we make. But again, I think that's the beauty of us as holistic thinkers and problem solvers, to support us with this area of practice. So hopefully from the last few slides you can see that as occupational therapists we are absolutely 100% perfectly suited to assess and provide recommendations in relation to work. At the core of our skills, we assess occupational performance, we analyse the person's ability to complete activities, we assess the environment, the person and what is important to them. We focus on the person's strengths and adapt and modify the task or the environment accordingly, providing a truly tailored and individualised rehabilitative support to the persons or people that we work with to improve their function and engagement in activity. We really do provide a truly holistic approach addressing mental and physical health needs and so much more, which is absolutely pivotal in supporting people with work-related issues. So what is the fit note? Well, the fit note is a written statement from a healthcare professional that indicates whether or not a person is fit to work or may require adjustments in their role due to health issues. It can be issued to inform an employer how long their employee may be unfit for work, and it can suggest reasonable adjustments to support their return to work. A fit note is usually only needed if someone is unwell and unable to return to work for longer than 7 days. And fit notes can also be referred to as a Med 3 or an eMed 3, depending on the clinical system that you use and how the fit note is provided. So, for example, the eMed 3 is provided electronically. Fit notes can now be signed by a range of healthcare professionals, including, of course, occupational therapists. And a person will need a fit note if they have already been off work for 7 days due to a physical or mental illness and remain too unwell to return to work. It can provide the person with proof to their employer that they have seen a healthcare professional who agrees that they are too unwell to return to work. And the fit note ensures that the person can have access to statutory sick pay, if eligible, and can include continued access to universal credit if the person is on benefits. It should also provide the employee with some protection against unfair dismissal, along with job security during illness. Clinically, the fit note can be a really valuable tool to complement conversations around return to work and the rehabilitation that might be required to support the person's readiness to return to work. It can give them a bit of a breather, knowing that they have some time and space to work on improving their health condition to help get them back to work. And an alternative to the fit note is the Allied Health Professionals Health and Work Report, which can be used by AHPs to provide a more sort of detailed report and recommendations for the person's employer to help them manage the health condition in the workplace. It can't be used to support a claim for certain benefits, such as universal credit, but it can be a really good tool to support return to work conversations between the employer and employee, and is something that I use quite a lot in practice to sort of really highlight the difficulties that someone might be having in work, and give a bit more of a detailed plan as to what recommendations we might make to support the return to work. The most common reasons for fit note use include for prolonged illness or injury, chronic and long-term conditions, post-surgery recovery, mental health difficulties, and to support with fitness to return to work. And the most common conditions or illnesses cited on a fit note are mild to moderate mental health difficulties, such as anxiety and depression, work-related stress. This can account for over 41% of fit notes. And I would say the vast majority of my caseload clinically within the GP practices does tend to be mental health difficulties. Lots of people struggling with work-related stress or bullying in the workplace, but also people who are struggling with mental health secondary to a physical illness that they maybe went off with originally, but they've had an extended period of absence from work and are therefore struggling with their mental health. The next common condition that tends to be cited on the fit note are back problems, so around 9% of those are attributed to that. Respiratory conditions account for 10% of fit note provision, and then the rest is attributed to drug or alcohol misuse. And when looking at the prevalence of fit notes provided as not fit for work, so i.e. people being signed off work, GPs were found by the DWP to be the highest provider of not fit to work notes at 93%, with only 7% of those notes recommending that someone might be fit to return to work with the adjustments or a phased return or things like that. OTs in comparison appear to consider adjustments more. 84% of fit note provision was not fit for work, with the remaining 16% as may be fit for work. But I'm sure you'll agree that this could be better. So the more we sort of have these conversations and become a bit more confident with having that discussion around work, we could maybe support a tide of change in how these fit notes are provided. Hopefully today's overview has given you a bit more confidence to complete fit notes and to make work-related recommendations, or at least to have those discussions within your practice. But if not, I'd really like you to have a think about why this is. What challenges, if any, do you face in providing fit notes in your practice or having those work-related discussions? And if there are challenges, what can you do to support a change in your area? You know, are there other OTs where you work or locally who have an interest in vocational rehabilitation and work-based support? Is there a support network out there for you that you RCOT have a range of support and resources on their website, and also the RCOT Communities platform, which you can access for free if you're a member of RCOT. There's a specific communities platform for work and health where you can access further advice and support and resources around work, and you can also put any questions on there that you might have around this sort of area of clinical practice and ask any questions to like-minded OTs. There is e-learning available, an online training regarding fit note provision, and there'll be a link to that just a bit further on in this presentation. But there's so much support out there and guidance to help build your confidence with this. All I would say is, as that little purple dot says, you're not an imposter, you're an OT, and you absolutely belong in this space, and we would be very happy to have you alongside with us supporting in this area of practice. Now, I'd just like to take a few minutes to show you this case study from Cheryl Fear, who's one of our occupational therapists who works within primary care.
Hi, my name's Cheryl Fear. I'm the first contact practitioner occupational therapist for Northwich Primary Care Network. I'm one of 3 first contact practitioner occupational therapists in this area. As part of our role, we complete fit notes for patients who would like to return to work. I'm going to share a case study with you regarding one of these patients that we have supported and enabled to return to work. She's a 56-year-old female who worked full-time as an assistant head teacher and Senko lead for a primary school. She'd recently been discharged from hospital following bilateral PEs in her lungs and was struggling with fatigue and managing to get back to her daily routine. She'd been off work for a period of 2 months prior to me seeing her. GP had referred her, asking me to support her in her return to work and fatigue management. When I first met this lady, she was completing all of her activity of daily living first thing in the morning when she had more energy, but by the afternoon was really struggling to complete these daily tasks. She was able to concentrate for approximately 20 minutes, but after this time was really struggling. I advised her to keep a diary to monitor her exercise levels from both a physical and a mental well-being perspective. We completed an activity analysis, having a look at her normal routine and discussed grading and pacing of activities, and really spoke in depth about the boom-bust cycle to support this from an evidence-based perspective. She then started to increase her exercise to 30 minutes a day, but was struggling to some extent. So again, we reviewed this and spoke in detail about pacing and making sure that she was able to continue doing the things that she needed to do and wanted to be able to do in her daily life. From a return to work perspective, we initially completed fit notes as she was unable to work, but then started discussing maybe fit notes to enable a phased return in terms of returning to work, and started discussing the benefits of this. I encouraged her to engage with occupational health and discussions with the head teacher around returning to work and what the plans in the future may look like. She did experience some crashes due to not pacing and poor self-management at time, but we were able to reflect on these within our clinic sessions and see what we could do to enable her to have a more balanced lifestyle and feel better in the long run. We also discussed her being a little bit more assertive, letting people know her needs and the fact that this wasn't a weakness. It was enabling her to recognise that loud noises was really negatively impacting on her level of fatigue and the physical responses that she was experiencing due to these outside influence and environmental influences. She was experiencing pain and pins and needles in her upper limb, so we talked about using pillows to help manage and relax her upper limb, enabling her to rest and gain the maximum benefit to enable her to accomplish everyday activities. She changed her diet to enable her to eat little and often rather than big meals, and found this very beneficial. The outcome was that she returned to full-time employment after a phased return to work. She was able to pace herself and be aware of her level of exercise, exertion, and fatigue, and manage that appropriately. Over a period of 5 months, 3 not fit to work notes were issued, and 1 maybe fit for work note was issued, which included recommendations for phased return, resting breaks, and a gradual build of hours and duties to make sure that we were able to take into account the fatigue that she was experiencing. After this time, she was discharged from our service, returning back to work successfully full-time in her previous role. Thank you very much.
To get started, it'd be really good to have a chat with your wider team about how you want to begin using fit notes and AHP reports. What is the purpose and benefits to your practice of doing this and the people that you work with? Why is it that you want to be able to use fit notes and AHP reports in your practice? Look at what you have access to on your systems. Are they actually set up to allow you to provide EMED3s? Do you need to look at some work-related questions in your assessment templates to prompt all staff to be asking the work question and to build the confidence with this? And think about having what conversations with the wider team to address any potential barriers and share ideas to support change within your area. Just a few closing thoughts to leave you with today. So many people choose to leave work or struggling work due to receiving incorrect or poor advice. We need to be the driving force to put occupational therapists at the forefront of implementing and shaping return to work services and having those conversations and supporting our areas of clinical practice to grow in this area. There's so many conversations happening at the moment around work services, and we need to be able to spread the word about occupational therapists, be able to speak confidently about what we do and how we can progress this area of practice. So really just take a few minutes to have a think about what action you can take and how you can help with spreading the word about what occupational therapists can do. Thank you so much for listening. I hope you found today useful and you've taken away some good information from this presentation that you can take forwards into your own practice. We'd really appreciate your feedback, so if you could scan the QR code on the screen now, it should take you through to a short survey to complete. Your feedback does help us to evaluate the impact of this training, and we'll use it to continually improve future sessions. And just a little reminder that this session does count towards your CPD, so please also consider recording any reflections about today in your CPD portfolio. For further resources and support, make sure you have a look on the RCOT website to see what's available to you there. There's lots of really helpful pieces of evidence and literature on there related to vocational rehabilitation. As I previously mentioned, make sure you get yourself on the communities platform. You can join those for free, particularly the work and health. Lots of interesting information that gets put on there with regards to vocational rehabilitation and work. You can look at joining some peer support groups through that. It's a really good resource. As I've already mentioned before, take a look at the Allied Health Professionals Health and Work Report. If you Google that, there should be some examples of these completed, just to give you a bit of a flavour as to how we might use these to support our practice. Do consider talking about vocational rehabilitation within your supervision. Again, have a look through the RCOT website to see if there are any supervisors available through there that have a specialist interest in vocational rehabilitation that can support you. There are lots of useful resources and guidance on the government website on gov.uk with regards to how healthcare professionals might be completing fit notes, what you might be using them for, just to give you a bit more guidance on that. And if you work in the NHS, you can sign up for the fit note training provided by eLearning for Healthcare, and that's a really sort of thorough webinar around completing fit notes. It takes a couple of hours, but it goes through why you might be providing them, how you complete them, what you write where, what boxes you tick when. And if you're working in the NHS, it's a really good training tool to use. So thank you so much for listening. I hope you found this useful, and I look forward to lots of you letting us know how you're getting on with having those work conversations. Thank you very much.